British Columbia's strategic focus, which is to improve the health system, and also the focus on the triple aim. We'll also attempt to bring some understanding to the attributes of organizations that foster engagement. So what can we do at our organizational level to engage patient and families? And also learn about some key skills that have been found in the evidence that foster patient and family engagement. So again, I'm sure most of you are familiar with the strategic focus for British Columbia, and the Ministry of Health has set out these 5 strategic areas of focus. And this webinar is part of the work that is leading toward overall improvement in quality and sustainability of the British Columbian health system. So certainly these quality improvements are both in the experience of care and also toward better health. And this focus is really in 5 key areas, and those are improving access to primary care through primary care home model, reducing the demand on hospitals by improving care for seniors, reducing the demand on hospitals by improving care for those with mental illness and substance abuse issues, improving access to surgical services and procedures, and to improve delivery of rural health services. So this presentation will try to link how to foster patient and family engagement, especially in relation to chronic disease management, to achieve these strategies. And the engagement of patients and families in these priorities, both from patients being involved in their own care, their family's care, and also to be involved at a system level, bringing about healthcare system change. So we know that all of these strategies will be important for us to be able to achieve this strategic focus. Many of you are also familiar with what's known as the Triple Aim. Triple Aim was developed by the Institute for Healthcare Improvement, and it has these 3 goals: a better experience of care, both for professionals and people receiving services, better health at a sustainable cost. And together, they're called the Triple Aim, and as many of you know, has been widely accepted by healthcare around the globe, including patients as partners in British Columbia. And I think this is, for all of us that work in healthcare, this is what we want: healthy people delivering care and at a price we can afford. So when we look at patient-centered care, we really want to think about self-management support, those things that patients do for their own health. We also want to look at shared and informed decision-making. How do we include patients and families in those important medical decisions and decisions about their health? We want to make sure that the experience of care, no matter where it's provided, is good for our patients and families. And we want to improve the information and understanding that families have about their health and their healthcare options. And finally, we want to advance the prevention and health promotion activities, so keeping our patients and families healthy from the beginning is another priority. And in the policy document, A Patient-Centered Care Framework, the ministry states that patient-centered care puts patients at the forefront of their health and their care, and that patient engagement will be necessary to ensure patients and families retain control over those choices, make informed decisions, and that engagement will support a partnership between individuals, families, healthcare service providers. And again, I think as healthcare providers, that's what all of us want: a partnership with our patients and families. We're all heading in that same direction, so we want to make sure that we're working together. Core principles for patient-centered care, and again, these won't be any mystery to any of you on the phone, but of course, dignity and respect, information sharing, participation, and collaboration. And what, again, you may well be aware of is that the BC Patient-Centered Framework outlined these nicely, describing these 4 core principles, and they'll be introduced throughout the rest of this presentation. Dignity and respect, we know, is really about listening to patients, respecting where they're coming from, treating them, no matter what their cultural background or circumstance, with respect that they deserve. Information sharing means that we can communicate in a timely way, be accurate, and also help families engage in the decision-making process, involving them to the extent that they desire to help make those decisions that are important to them. We also want to make sure that patients are encouraged and supported in that care and in that care process. Sometimes in the hustle and bustle of healthcare, we may not stop always and ask what the patient and family think, and we can learn to do that differently through systems changes and really incorporate the family in the care decisions. And then finally is that collaboration, and I like to think of this as a partnership, a really meaningful opportunity to engage with care providers, leaders, and family members to make sure that the health care is designed appropriately and delivered well. At the last webinar, many of you saw the stepped care self-management support. We are again starting on the foundation here of stepped care support, and we will remember that patients and families may need different levels of support depending on what their situation is and also depending on their condition or health circumstance. So again, we're going to be starting with the bottom. We consider this to be foundational as far as any of the care that we provide for patients and families will not happen without engagement. So a very important component indeed. This is from the General Practice Services Committee. That's the joint committee of the Doctors of BC and the Ministry of Health. And they've presented a plan for co-creating the future of integrated care. And you can see here a new plan for the patient medical home, primary care home. And I know many of you are considering how your organizations are going to interface with those new priorities and how your organization can contribute to this overall movement within the Ministry of Health. And again, as you'll see, provides support for patients and really provides that linkage to stepped care self-management support. And again, you see the coordination, comprehensiveness, and access, and all of the different components of care, considering key populations, those with special populations, or care needs, and not forgetting that preventative care, that all-important preventative care to help us not get into such dramatic circumstances and really protect people from some of the many things that can happen when they have chronic disease. So if we think for just a moment, we've talked already about engagement, but it's interesting to just reflect for a moment, what does engagement mean to you? And I'd invite you to jot down just the first few words that come to mind. And I think if we were able to hear from everyone on this webinar, there'd be a lot of variation about what engagement means. And in fact, if you did a Google search, and I did this not too very long ago, 9.8 million results. And when you start to look at some of those, and no, I did not look at all of them, but there are a lot of different definitions out there. And I think depending on your role in healthcare and what your actual job is in contributing to the care system, you might have a different impression. So if you're an administrator, you might consider that engagement, good engagement would be to follow through with paperwork or keep an appointment. Or if you're in the hospital, engagement might be to follow the guidance of caregivers and to participate in discharge planning. Maybe engagement means following some rules like going to see the general practitioner before seeking urgent care. Or maybe it's taking medications as prescribed. Or maybe it's reading educational material someone gave you that would be of benefit to your health. Maybe it's signing up for a portal. So again, it really could be just about any and all of those things. And in the broadest context, it's really about engaging people in more healthful behaviors and decreasing less healthful ones. So again, the takeaway point here is that engagement is broad, and when we talk about it, especially at our organizational level, we need to be clear about what we mean and what parts of engagement we really feel are important. And so for the rest of this webinar, we're going to explore some attributes of engagement that are important as we think about our roles in helping British Columbia achieve that triple aim: improved patient and provider experience, and improved health outcomes at a cost we can afford. So, as is often, we start with a definition. And this definition is from Coulter, and the definition reads: the relationship between patients and healthcare providers working together to promote and support active patient and public involvement in health and healthcare, and to strengthen their influence on healthcare decisions at both the individual and collective levels. Well, that's a mouthful. And that is really a process that brings people together. And there's a couple of portions of this definition that I would like to highlight. So the first really talks about supporting patients and public involvement in healthcare. In order for people to be involved, they need to have knowledge and awareness. They need to have information that's provided in a respectful way and provided in a way that they can understand. But this definition is more than just awareness and education. It's really about taking action. And so for some, if they know what's best for them, they'll be able to just do it on behalf of their health. And for others, as we've just talked about last time, we may need to take a stepwise approach. We may need to work harder to engage people in their health and support them to take action. And that also involves supporting the system in which they receive care. If that system is welcoming and well designed and meets their needs, they're much more likely to continue to engage. I also want to be clear that there are some things that we're not talking about. So when you look in the literature or you search, you'll see patient experience, patient confidence, patient activation, and patient satisfaction. And they're all related to engagement, but there are a couple of things that I want to be clear that are not, and that would be patient adherence and patient compliance. And so what we're talking about is not that the patient obeys us. It's not that they adhere to our treatment plan or they comply with what we're asking them to do. Engagement really is working together. It's a willful and active participation in health, and it's really directed by the patient. So just to be clear, that's what we're talking about here today, that type of patient engagement. So we know that Patients as Partners has charters for individual care, for program and community service, for system redesign, and I know each of you are really thinking about how we can navigate engagement across these different levels in our redesign and in our day-to-day work. So how do we involve individuals and families and use the skills that we have? How can we engage program and community services that is respectful of community autonomy and respectful and builds on the work already in place? And then how can we together build a system that really wraps around patients and families and welcomes their participation and really looks for the best outcome that we can achieve together? So we know that engagement itself relates to determinants of health and health outcomes. And one of the things that intrigued me early on as a clinician was the fact that medical care itself only accounts for about 10% of the determinants of health and their contribution to premature death. Rather, personal behaviors accounts for about 40%. And so we have a great deal of opportunity to influence and guide and support patients' healthy behavior. So rather than thinking about it, I can only influence 10%, I choose to think about it that I can influence over 50%. And so when we're talking about engaging our patients and families, it's really critical that we recognize that we have influence and that if we engage our families correctly, we can improve their health with their cooperation. We know that engagement relates to the patient experience and that patients who are more engaged in their care felt that their care was of higher quality and a more positive experience. We know that the fact that how patients are treated in the healthcare system can actually shape or determine how patients will interact with that system moving forward. And patients who are highly engaged are less likely to seek emergency care and are hospitalized less often. We have some data from activation and cost data, and we know that in large systems, when measured, we know that about 15% of the patients with the highest clinical risk scores, they took those and they looked for how activated, how engaged were they in their care. And it turns out that the lower the activation level, the higher the utilization and the cost of hospital services. So in addition to all of the reasons why we want patients engaged to benefit their health, we also know that engagement will decrease the overall cost of care to the system. So it's yet another reason for us to be concerned about engagement. So I think we've reinforced the notion that engagement is really essential. So since we are committed to the 5 strategic areas, and since we're committed to the triple aim, engagement is really a foundational piece of our strategy, and that's why we're really talking about it today. So when we think about improving the healthcare system in those 5 strategic areas, so establishing primary care homes, helping seniors, those with mental health and substance abuse, making sure that services are available for patients needing surgery, and those in rural and remote areas, we've recognized that we may have to think about our engagement strategies in different ways. And one of the things to think about as we're thinking about engaging these variable populations with varying needs is who owns this? Who is really in charge of making sure that patients are engaged? And it was interesting, this 3 perspectives of patient engagement study looked at that. And the take home from this slide is around the ownership, where providers, the care providers, believe patients need to take more responsibility for their care, and that patients believe providers need to be more willing to spend more time with them. And so patients really felt that providers owned the engagement piece. So keep that in mind when you're thinking about this, and it's not an either or, as it turns out, and we already knew this, that the expanded chronic care model, and again, I know many of you are familiar with that, which really looks at the entire healthcare system and thinks about how do we align what we're trying to do with patients on behalf of patients with what they can do for themselves. And it really comes down to that bottom of the slide, that productive interactions and relationships. And we know that that's really what healthcare is about. It's those relationships that really guide us to provide good care for people. And it's really between that activated community and informed activated patient and our team that is prepared and our systems that are prepared to deliver the best care possible. So again, if we look just at the bottom of that slide, that's really what we're talking about. How do we provide engagement so that we can get this productive, interactive. And for those of us that see patients on a day-to-day basis, it's really about that relationship. That's when we can do our best work. That's where we can really make a difference, one patient at a time. For those at an organizational level, setting up the space to allow this to happen is critical. So all of us on the phone have a role here to create this dynamic where patients and care teams, no matter what the care team is, can work together toward better outcomes. We know that healthcare service providers, that we know that engagement is incorporated at a core level. It's an organizational strategy in those healthcare providers that do this really well. The attributes of systems are that they value empathy and compassion. They know that the system includes those supports so that we can anticipate the different needs of the population served and really provide support along that spectrum of engagement. I mean, we talked about seniors and those using substances, those who live in rural areas. They're going to need different types of support. So how can we use overarching principles to guide us? And we're going to talk about some of those system attributes in just a few minutes. The other thing that we can do as healthcare providers is that we can train our staff in communication skills and skills, evidence-based skills that really foster engagement. And we can also measure patient engagement to make sure that what we're doing is working and to make sure that we're always improving, always listening, always improving our patient engagement. So this is just one way to look at things that organizations who engage populations well do. So first, their organizational culture is constructed so that in actions and words, they really value staff that are empathetic, that really care about their patients, and not only care but demonstrate that care. We in healthcare, I think most of us really care deeply about what we do. What I see sometimes is that we're not always transparent about that, we're not always visible about that. That our organization embraces the patients and families as partners, not someone to care for, but to someone to care with, to design care with. Very big distinction, and organizations that do that well have that embedded in their system. Of course, dignity and respect goes without saying. Another thing that the culture will provide is that space that I mentioned a few moments ago, that space to allow trusting relationships to happen. That would involve things like continuity, seeing the same care team or care person time after time so that relationship can build. And giving people time to create relationships, really important in today's healthcare. Transparency about care. Being clear about what's going to happen so that there are not surprises. Universal precautions, that just means speaking plain language to everyone. I always laugh when I talk with my residents, that we spent all of this time learning Latin and then we have to unlearn it because we want to speak plainly so that people can understand us, and making sure that people have the access that they need to the services that they require. And the other thing that really facilitates engagement that happens at a system level is that these organizations provide tools for staff and professionals to make sure that they're confident in providing care in an engaging way for the patients and the families that they serve. So if we think about what is important to make a positive healthcare experience, when you ask patients this question, there's a couple of things that come out again and again. I've quoted one study here, which is the Health Partners experience, but many studies will reproduce this. So the first is having a doctor or the caring person, the care provider that listens to them. 85% of patients say that. That's a pretty high rate. Having a doctor that is caring and compassionate. And again, as I mentioned, it's demonstrating that care and compassion. Some of us in our training have been taught not to be so demonstrative perhaps, but patients will see if we care, and that's important. Having a doctor that can explain things well, and that means being able to explain in a way that people can understand. And then finally, that access component. So I think these are fairly aligned with what we've talked about so far, and certainly with the ministry's objective, how they're thinking about asking organizations to put these systems into place. It's the exact same thing that the patients want from us. So now you're thinking, well, that all sounds fine, but I have challenges. So I ask you to reflect a moment about your challenges to engagement. And I've asked this question to quite a few healthcare professionals in the States primarily, but I get similar answers, and I bet that they're real. And I bet that many of them are similar for you as well. These are the things that I commonly hear. And on the left-hand side are things like patient beliefs and social determinants, pain, mental health issues, substance use issues are there too, complex medical situations, and all of those challenges are real. Certainly patients and families cannot engage as completely when there are things that are in the way. But I do want to caution you not to think too superficially about engagement, because all of the things on the right-hand side are things that I also hear. And all of these things are things that we as organizations and providers of healthcare can control and influence. So we don't always address them, but we really do need to understand how to make them the best they can be. So when we're thinking about transition of care from one provider to another, we need to think about it from the patient perspective, not just, oh, somebody else is going to take over care now, but how are they going to do it? Does the patient understand who to call when they need something? Is everything clear and standardized as we transition? We know that continuity, I've mentioned that continuity is a big deal to patients so that they can form that trusting relationship. We know that some things in our medical model where we're trying to fix patients' problem instead of engaging them in solutions, very different approach. So there's some things in our medical model that may get in the way to engagement. We may bring biases with us, some of which we may not even be conscious about. Some patients we've seen for a long time, and we may have given up on them. You know, there's nothing that I can do or say that's going to change the health of this patient. We've got to let that go. And then finally, for many of us, there's time pressure, or there's too many things to cover. All of those things on the right-hand side can be drastically altered and improved. And so as we're thinking to challenges and engagement, we can't let ourselves off the hook. We need to work on these things, and we can overcome them. The other thing I want to mention is the myths that are associated, and I think I've heard all of these in my career, is that, yeah, I can move fast and I can see a lot of patients, but I can't get patient satisfaction too. Or if I had more time to spend with patients, I would have greater patient satisfaction. Or, you know, some people have it, some people don't. I'm never going to get satisfaction with my patients. So these myths are amusing to read, but quite frankly, all of them are not true, and all of them can be mitigated with skills that are easily learned, and also an organizational commitment to patient engagement that I've encouraged you to think about. The next thing just to consider is that engagement is dynamic. So even if we think about all of the great skills that we have with our patients, disengagement is going to happen. And so the best thing that we can do is just to expect it to happen. And I invite you to think about, have you ever had a conversation with your spouse or your partner or friend, and you said something and what the other person heard wasn't at all what you intended? And of course you have, we all have, and it's no different with patients. And so we need to recognize that disengagement is going to happen. We need to be able to recognize it, and we need to use our skills to get back on track. This is one of my favorite ways to think about patient engagement, and it's really thinking about how the patient side of the equation is going. So from a patient's perspective, if they are engaged in the healthcare system and things are going well, it's more like dancing. It's more like flowing, moving, people moving together. They're going in the same direction. And on the other hand, when a patient is not doing well in the healthcare system, it's more like wrestling. And, you know, this metaphor is a fun one to think about. And if you think about the last day that you had working in healthcare, you can almost pick out those interactions that you had that were wrestling versus those that were dancing. So with wrestling, one or the other is trying to win. It's definitely not a partnership. So yes, I know it may seem funny, but we want to be on that dancing side. We want to engage our patients. The experience of providing care to them is much more enjoyable for us as well. So I wanted to introduce just one case study to help us think through what some of these skills might look like. And this is Zach, and Zach is 28, and he's suffered from undiagnosed depression for many years. He's self-medicated with alcohol and more recently cocaine. He's ended up in the emergency department with very high blood pressure and a rapid heart rate, and he told his caregivers in the emergency department that this was his first time using cocaine. Part of his discharge planning was to set up an appointment to establish care with a general practitioner, and he found that Zach's blood pressure was high, recommended some lifestyle changes, including increased exercise and a healthful diet. And when the blood pressure remained high, medication was recommended. Now, how Zach is going to react in this situation has a lot to do with his experience right now in healthcare. He's new to the system. He's clearly not disclosed everything to his healthcare providers. And what we do at this moment can really change the direction of his care and also how engaged Zach will be. And so the good news about engagement in activation is that we as care providers can influence that. And we can actually improve engagements by skillful utilization of tools and strategies and being welcoming to that partnership and being a safe place for Zach to tell his true story. So if we think about activation and the situation of Zach, and we'll just concentrate on the blood pressure for right now, Zach could say, well, I try to do the right thing for my blood pressure, but it's hard to remember. And that's a patient, and we've all heard this scenario where they're not really engaged. Yeah, I try, but it's hard to remember. Not really putting the effort forward that you would like to see, but through strategies and support, we can help Zach to the next stage, where he is actually doing some things. He's trying to eat fruits and vegetables. He's trying to follow that healthful diet. Some days are better than others. So he's admitting that he's not always doing, but he's aware of what he needs to do. And this is an indication that Zach would be more engaged. The next level of engagement might be, I'm working hard to get my blood pressure under control, I'm making action plans, and things are starting to go my way. So here's an individual who's really working hard to make changes in his life with support of his care providers, definitely making progress, and you can hear from a statement that he would make that he's more engaged in his care. And then finally, our ideal is medicines can only do so much. I have to do my part to watch my diet and exercise. And so you can see again the level of engagement, where can we be with patients, and we can move many of our patients higher in their level of activation as we partner with them. And we hope that over a period of time, Zach will become engaged in his healthcare and have better healthcare outcomes. So what are some of the things that work to improve patient engagement? Some of those things are education about how people can self-manage, but it doesn't stop there. We also have to make sure that people are involved in decision making. So for instance, with Zach, if we were thinking about a healthful diet, telling Zach exactly what he needs to eat instead of offering him options would turn him off. But if we offer him, well, Zach, here are some things, what do you like? What do you enjoy eating? Involving him in those decisions is more likely to succeed. Emphasizing problem solving. Some of the people that we take care of are not good problem solvers, and we can teach them strategies, how to solve problems, and eventually they get better at solving their own problems. Developing a care plan that is a partnership, so not just what the care team wants, but also what the patient feels is important. And then that follow-up, that support to set little goals, little steps, following up on them over time. These are all things that we know work, all evidence-based things that can promote engagement in health and health care and really make our jobs a lot easier. Additional things that we can do would be to motivate people using information and support, targeted approaches. So if someone's struggling with physical activity, utilizing some targeted approaches like giving them options for physical activity, offering some ways that they could be supported with family or friends, things like that. Also, helping people understand what are the danger zones, when to take action, helping them not wait too long. We also know that some other things like managing social, emotional, physical impacts of conditions are important. A disease is not just a physical ailment. It really does impact social and emotional components of a person's life, and that's important as well. And then things like outreach or proactive follow-up and providing opportunities where people with similar conditions can talk with each other. A lot of work has been done on peer mentorship and how supportive that can be for people going through care dilemmas and situations that are challenging. So as we think about all of these things that we just talked about, how would Zach fit into this? He has an opportunity, he's at a care provider. We know that in primary care, depression is only discovered about 50% of the time it exists, so it may or may not be diagnosed. But probably as important as to whether Zach engages is how did he feel with his GP? Was he connected? Did he feel heard? Did he feel like he could say that he was using drugs or perhaps not following a treatment plan? Did he feel safe to do that? Was he given information or options about medication? Was he judged about what he was doing currently, or was he allowed to explore a better future? So each time a person interacts with the healthcare system, we have that opportunity to engage them, and we can use it or we can waste it. And so the decision really is, how do we, at an organizational level, really engage people every opportunity we have? And so the next steps and partnering with patients really has a lot to do with that patient experience. Some skills and tools that you can consider, and we're going to talk about these each one in turn, but listening actively, being intentional when you are meeting with someone, using respectful strategies, evoking what matters to the patient. We'll talk briefly about change talk, and then also action planning. So the first of these is to listen with empathy. And we have to care as we listen, and that caring needs to be evident. So one way to do that, as we're thinking about and listening to a person's story, is we can use appropriate eye contact, appropriate to the culture. We cannot cross our arms. We cannot look at our phone. We can actually look at the person and be interested in what they're saying. And we can ask questions that would clarify what that person's story means and reflect back. These are strategies for active listening, and we'll be talking more about these as our webinar series continues. The next is really being intentional about what we bring to the encounter. We have to remember that sometimes we have biases. We have some of those negative feelings towards certain patients. We have time pressures, and maybe we're not as hopeful as we might be. And so being intentional and bringing hope, I think that's a big part of being in the healing profession, is to bring hope to people about a better health and a better life. The next is the spirit of motivational interviewing, and again, we'll be covering this in further webinars, but it's compassion, being able to understand where a person is coming from and wanting to act on their behalf. Acceptance of where people are and what they need to do next, and sometimes those steps can be small. That partnership that we've talked about, and then finally evocation, believing that the person has the desire to be healthy inside of them, and we have to understand more about that. The strategies such as ask, tell, ask. This is a strategy that we cover in brief action planning, but it's a strategy to give information. It involves a first ask, which is to ask permission or to ask what they already know. Giving information in a way that is not overwhelming and that in a way that people can understand. And then ask how it was heard. Again, checking back for understanding or using the teach back technique. The next is evocative questions, and I think many of you have had training in this, just asking some more questions to keep that person talking so that you better understand where they're coming from and what they need, asking for more detail, using important, how on a scale of 0 to 10, how important is your high blood pressure to you today? So just getting more about what matters to the patient in the overall care process. Next is the language of change. This is really powerful. This is about how people talk. So in the medical model, people are used to talking to their patients by saying things like, yes, you really need to do that. And although that may seem supportive, really what you're doing is telling people what to do. And rather, if we learn to listen to what the patient says that they're willing to do or want to do, we can support that change. Again, very different way of looking at it. We do a lot of this on our webinar in motivational interviewing, so more on change talk then, but it's a great skill. The next is the action planning. We'll talk more about this in our brief action planning webinar coming up. But when that change talk becomes strong and patients are thinking about making a change, supporting them with a plan is really important, and it helps them be successful. It helps them be more confident in making a change. Change is hard, we all know that. So this planning process can really bolster confidence and really help people make the changes that they desire to make for themselves. And the good thing about these skills, these 6 skills, is that they can all be taught. So for all of us that are in systems, in organizations, we can learn and practice these skills. And in turn, all these skills can further activate our patients, further engage our patients. So I guess the message here is that we have some work to do perhaps in our organizations and how we've been thinking about things, but it's feasible, it's doable, and the rewards are very great. Some things just to think about, as we know individuals aren't engaged, we know that if there's a relationship problem or there's resistance, and some of you will recognize these, the teens who say, yeah, whatever, and the person in denial, or the toddler who just says no, or the person that's 100 years old and continues to smoke, and those teenagers on their phones. So we see evidence of resistance all the time, that they're not engaged, and that's okay. We now have skills where we can get them back on track. So how do we know, in addition to these very clear nonverbal clues that we have here, how else do we know? Well, what we found is you can just ask them. So how are you managing your healthcare plan? How is your diabetes, fitting into your life? Or, what kinds of things have you been doing for your health? Very quick conversations will let you know how engaged a person is in their health. And then you can observe, are they talking with you? Are they partnering with you in care decision? Are they asking you questions? Are they following through with their action plans? So important that we include this in our system, that we allow the space for individuals and families to be engaged, and that we monitor when they're not engaged. We need to find out why and try to get them back on track. At the population level, we'll be exploring more about this as well, but there are some metrics that you can consider. And some of you I know are already measuring patient experience across the province, but just a couple of ideas are listed here on the screen. But we can also look not only patient by patient, but we can ask our population of patients. And that gives us a good idea of how our healthcare system is performing to engage all patients for whom we care. So I think in summary, I'd like to say that, and I hope that with some of this data and conversation that we've had today, that you recognize how important patient and family engagement is, both as a strategy to reach the triple aim, to align with the ministry's strategic goals, and to improve healthcare in British Columbia. I think from a healthcare provider perspective also, patient and family engagement is really a key to a rewarding healthcare provider career. So if that's your reason, that's a good reason as well. Also, organizations can improve patient and family engagement. They can make those system level changes to really value compassion, empathy, engagement of patients and families as partners, and engaging them in designing a system that works for them. And then finally, there are skills that we can learn, those 6 skills that we went through that really bolster a staff's ability to engage patients on an individual level and also to engage in a healthcare organization that values patient engagement. I want to just point out that there are some resources here on your slides. These will be available as part of the webcast. There are references available that are all of the things that were cited during this webinar. And I will now look to see if there are questions. So I have a question from a person. How are you defining the level of activation? That's a great question, and there are several different ways of doing that. There is a scale called the patient activation measure that was started by Dr. Hibbard, and the references are in your slide deck, that takes a series of questions and assigns a level of activation. But many people use a less formal approach, and depending on how the patient and family is engaging with you at the time, you can tell how activated they are. So it's not so much having a numeric value on the level of activation, but are you able to partner with them at that time, or what do you need to do differently? So if you're designing a care plan together, or you're a home health aide and somebody is supposed to be making a meal every day and they're not making a meal, that person's not engaged in their care. So how do you engage them to provide that meal? And that's using some of those skills. So assessing the level of activation, is it sufficient to meet the needs of the care plan? And then what can you do to improve it? It's another question about clients with dementia who live alone. How do you keep them engaged? Ooh, wow, that is a really tough one. And dementia is a challenge because patients with dementia don't always remember you from time to time. So I'm assuming that that person is safe alone, and that sometimes patients with dementia do not respond to things like motivational interview because they can't remember long enough to keep that relationship. So keeping them engaged is more often keeping the caregiver engaged. So that's a great question, and certainly patients with significant substance use disorders, patients with mental health and in the throes of acute psychotic episode, and those who don't have the mental capacity to engage are really challenging and don't respond very well to the skills that we described. There are a couple of other there are a couple of other entries, and I'm wondering if they are responses. They don't seem to be a question, but I think they are responses to what does engagement mean to you. And I'm just going to throw them out because they're great. So one is hope and a feeling of support, and another is clear communication. So engaging may have those characteristics, and I think that's great that people type that in. Any other questions, Troy?
There was one question that asked if the slide deck will be made available, and it will be made available, but in a PDF format, so you'll be able to review the slides in a PDF. That'll be accompanying the recording.
Great. Okay. So let's see. So I'll move on to next steps. Feel free to contact us at any time. I encourage you to continue to learn more about engagement, and you can contact your patients and partners lead and your health authority, or contact us here at CCMI. I think that there are additional webinars that are coming up. Informed decision making and the brain worksheet will be held on August 31st. Sam Burnett and April Lawrence will do that. And then there'll also be a survey following this webinar. And we hope that you will participate in that survey. Tell us what you liked, what you didn't. We are always interested in improving the information that we're sharing with you and improving your ability to engage with us. There's one more question. Let's see. How do you keep track of what you've done with each person, especially those that repeatedly don't engage but might in the future? So there's a lot of different strategies that people use. It depends on the type of care that you provide, but certainly, so if you're in home care, you might have field notes that you keep. You might have a care plan that you manage from time to time. In primary care and hospital care, there's ongoing notes that are updated periodically. And my belief is that part of the care plan should be the level of engagement or what you're struggling with, or what I often write in my notes is how to engage. So if I know someone is really interested in seeing their grandchildren grow up, then I can leverage that piece of information. So I put it where I see it, because I can't remember all of my patients personally without the documentation, but it really helps to have that tracking type of strategy. So again, in the big picture view, depending on the type of healthcare you provide, is typically part of your note, part of your care plan, and trying to figure out how to engage people in the future. So with that, I think our time is up. I want to thank everyone so much for your attention. I hope some of this information was helpful to you. We want to thank you, and again, we welcome you to contact your health authority leads, patients as partners, or us at CCMI, and the website is there for you. Thank you once again, and have a wonderful rest of your day.
Thanks all for joining.